Hello, Miss E. How are you?
I'm great. How are you?
I'm doing just fine. Now, after we've completed all your health history at this time, we're going to go ahead and do an assessment on you and everything.
Okay.
Again, real quickly, you said that your chief complaint was you were having headaches basically for about a month and a half now.
Mhm.
But what brought you into our clinic today was because you want to get your prescription refilled.
Yes.
Okay, very good. One of the things I do want to do cumulatively is we're going to go ahead and do a Snellen chart. This is actually going to be simulated, but what I would have my patient do, and this, man, if you will just stand over here, and you'll see a chart right over there. We're about, you got a line right there, we're about 20 feet away. Okay, what I want you to do is cover your eye, all right? And go ahead and read for me the smallest number. Try line 10 first. Can you do that one?
PQRSTU.
Very good. Okay. All right. Close your other one and try line 10 again, but read it backwards. I'll try line 9.
Okay. FEDBC.
Okay, that's pretty good. You only missed one. That's good though. Okay. All right. Now same thing with your glasses off real quick. Okay. Cover your right eye and read the smallest one you can.
E.
Okay. All right. I think you were telling me about your history with your eyes and all. Okay. Let's try the other eye. Read the smallest line you can.
I really can't make out any of the letters.
Okay, I understand, no problem. Go ahead. All right, very good. And that's it for now. What we're going to do is I want you to take a gown with you
Okay.
and take this cup
Okay.
and give me your specimen. And you'll see there's a little shelf in there. Just leave it there in the lab and get that for us.
Okay.
And I'll meet you right back here. We'll get on with the assessment.
All right.
Thank you. While my patient's getting ready, just for the sake of time, we are deferring the genitalia assessment part to this. There will be some simulation with some of my instruments that I couldn't get. I'll be simulating the hammer for my deep tendon reflexes. The ophthalmoscope and oscope will be simulated as well. But just for the purpose of information, I wanted you to know. Very fashionable. Okay. All right. Let's just take it here. You ever fall on or anything like that?
Mm-hmm.
Or ever?
Mm-hmm.
Okay. Tell you what, let's take your glasses. Well, you know what? You probably need to leave them on. I'm sorry.
Okay.
I'm sorry. Just leave those on. Okay. Go ahead and let's cover your right eye. And I'll do it with you. All right. What I want you to do, you see this?
Mm-hmm.
All right. Let me know when you see it again. Okay.
Okay. Okay. Okay. Okay.
Very good. Now swap over.
Okay. 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 Okay.
Very good. Okay. Now, what I want you to do, what I'm doing is I'm checking the fields of your eyes. We're just kind of checking your field of vision actually, and also what we call cranial nerve 2. Just taking your optic nerve out real good. What I want you to do is just isolate on something kind of distant, if you will.
Okay.
Can you even see the exit sign out there?
Mm-hmm.
Okay, look at it. Just click it real good.
Do you want me to take my glasses off?
Nope, leave them
Okay.
on. Just leave those on. And when you can, when I ask you to, I want you to look at my finger, okay? Go look at my finger. All right, back at the sign. Finger. And sign. All right, very good. Okay. Just looking for a pupil reaction there. Okay. And with my simulated light here. Just go straight ahead and we'll shine at the side. Any history of glaucoma in your family? Okay. Alright, just shining the side here. What I'm doing is look for a shade. The light comes through. What I'm doing is literally just shining light through your part of your eye, your anterior chamber. And if it's proper, it should go over and shine to the other side there, which is what we have.
Okay.
If you didn't have that, it's a kind of sign of the interocular pressure increasing there. Okay, again, let's look straight at my nose here, and I'm going to shine a light towards your eyes. All right, very good. I see both pupillary lights there, no problem there. Now, again, over here, let's cut this down a little bit. Just right here. There we go. All right. Again, look straight at me again, and we'll shine a light over into your eye again. Very good. Good pupillary reaction. Very good. And it's consensual. I see both of them doing that. Okay. I'll tell you what, over here, we'll shine a light again. Now this time I do want you to take your glasses off, please. All right, what I'm going to do is I'm going to shine a light toward one eye to begin with. And what I want to do is I'm looking for a red, what we call the red light reflex. And I'm literally looking in the globe of your eye, the inner eye, and we're looking at what we call the macula. And when I focus on that, I'm looking at all your vessels, looking at your optic disc and things like that. Okay? All right, let's stay there. And, okay. And I'm trying to keep that in my view. All right. And I can see the optic disc. Nice. Nice and round. Not jagged on the edges or anything. Both your all arteries and all four quadrants in there are looking good in your veins as well. Don't see no signs of hypertension or anything like that. Okay, do the same thing with the other eye. This must be a little rough on you a little bit. And there we go. Got the red light. Go into it again. Yeah. After this looks really nice. It looks pretty much normal in there. Okay. Alright, hopefully that wasn't too bad on you. Okay, one last thing. Again, same concept. I want you to look at my finger and just keep your head still and just follow my finger with your eyes.
Okay.
All right. Very good. Okay. Both of them consensual and as they should be. And again, we're just checking for 3, 4, and your cranial nerve 6. All the ocular controls your movement of your eyeball, basically.
Okay.
Okay. All righty. Let's look at your ear now. All right. What I'll do is take a look at your ear now, inside. Alright, looking at your tympanic membrane in there. For landmarks, good reflection, everything looks good, no drainage, all that good stuff. Looks good, very good, no drainage or anything like that. Okay. Now, while you're there, I'm going to stand behind you. And I want you to tell me what I'm saying. I'm going to whisper a little bit and you tell me, just repeat what I say.
Okay. 3B4. 12-2G.
Very good. All right, thank you. Okay. All right. Let's open it up there. All right, and stick that tongue out. All right, shine light down here. Say ah for me, please. Say ah. All right, very good. Say again. Ah. All right, sorry. Good. All right, just checking your hand reflex and all. Make sure you're okay. You need some tissue?
Not fine.
Okay. Anyway, just make sure everything reacts like it should, and we're just basically checking cranial nerve 9, your glossopharyngeal one, your vagus nerve as well, and just all that seems to be pretty much intact there. Okay. So here. Okay. Does that hurt? Okay. Sinuses. All right. Teeth. Okay. You got a pretty smile, man. Okay. All right. While we're doing expressions, go ahead and give me a smile again. All right. Give me a blowfish look. There you go. Very good. All right. Close your eyes. All right. And I want you to open them. Okay. Very good. All right. Go ahead and look to your right. And look to your left. All right, very good. Come back again. All right, go to your right. All right, and go to your left. All right, very good. All right. All right, I'm just going to check your lymph nodes here now. You didn't have any colds this year?
No, not yet.
Not yet? We've got roughly 10 sets that we look at when we do this, because there's your cervical area is pretty much full of quite a few nodes. Okay. Turn your head down a little bit. There you go. All right, you want it back up? Very good. All right. Let's see you swallow. Again. I'm sorry, did I mess you up? Go ahead and swallow, please. Just one time. That's all I need from you. It's doing what it should. Basically, to make sure that your thyroid moves like it should, and it does. Okay. I want you to just hold your breath. Very good. I'm just checking basically for any breweries in your carotids and all stuff. Now, another thing we're going to simulate here, I'm going to hand you this glass of water. All right. And let me go again behind you, please. And if you would, just tilt your head back just a little bit. When you get well, go ahead and take you a swig of water, and then before you swallow, just bend your head back just a little bit. That's good. And go ahead. You swallow? Okay. All right. Again, just checking your thyroid gland right there for any kind of allergy. All right. Now, if you will, I want you to say 99.
99.
Okay, again.
99.
Very good. Again.
99.
All right. Very good. What I want you to do, for right now, just breathe out. And just, all right, hold your breath there, please. All right, you breathe. Just give me a deep breath. And out. Again. There we go. All right, very good. Thank you. Now we're just checking. Make sure you're breathing, as we call it, good equal excursion, and you are. Okay. And deep breath again. 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 And one more time. Very nice. I think I'll wait till you do I have you laying down and finish the rest of that. Let me give some thought here. Let's see here. Okay. What you do is, if you can, can we go ahead and, if you will, just drop your gown just below your breast, please. And we're just going to check your breast out now, okay? No, we did. There you go, thank you. All right, just put your arms, behind your head, like this. All right, very good. And what I'm doing is just check for symmetry and all. Okay, now bring your arms back down. All right, now we're just putting it to your hips, push in. Okay, very good. And put your hands together like this, and push in again. Okay, very good. Now, what you do, we're going to have you lay down. If you will, I'm still going to need to get to that, so if you will, just go ahead and lay down for me, please. It does not? We'll be simulating that too, I guess. Okay. Now, what I want you to do is, what we're doing, obviously, as you know, we're doing just doing our breast exam here. So what I need you to do, if you can, just start with your right. Just put your right hand behind your head again. Just a minute. Okay. And all I'm going to do is I'm going to go basically in a vertical motion like this, up and down like this. All right, and I would do that up and down, up and down, up and down. And I would do it at different pressures. Basically, and obviously what we're hunting for is any kind of unusual nodules or anything like that. No, just something unusual that shouldn't be there, obviously. And seeing if it's painful, seeing the size of it, and just that in itself. Okay, additionally, you can bring it back forward now. All right, let's do the other side. Okay, same thing. I'm starting on the over here. Just kind of up and down, up and down, up and down, up and down. Okay. Now, another thing I'm going to do, just letting you know, is we like to make sure that there's no discharge from your nipple or anything like that. So basically, we just take it and pinch behind it, And I would actually just roll it behind the nipple, basically just like I'm literally folding the tissue behind there. And it's like, basically what I'm looking for is any kind of discharge. Okay, so, and we don't have any there. Now this would be normal, obviously, if you're, already pregnant or lactating already. So, but right now in your situation, we would want to see that, so. And the other side was also is good, we have no discharge whatsoever there, okay? All right, let's see. Tell you what, I do want you to sit up. So I'm gonna do one more part of it. Okay. All right, another part to your, oops. Of your breast exam. The last piece I want to do here is let me have this one. Is I want to support it like this, and I want to reach up in there on what we call the table of spins. Basically, that starts from your, like if you were to take a look at your breast like I do right now, and you would put it in relation to your nipple, 4 quadrants. And the outer quadrant, in this case over here, both outer quadrants is what we're talking about. Your tail of spin starts there, and it's like a bunch of nodes that go right up in the axle. Okay? So, and I'm just palpating that to see if I feel anything, and I don't. All right. Now, all right, this part we're going to simulate again. Before we go into this part here, before I can lay back down, while we're on this breast exam, I did want to ask you, do you do breast exams at home?
Yes.
How do you do that?
Usually in the shower.
Okay, that's good.
And I just put my arm back and I just divide my breast in 4 quadrants and go from top to bottom in the middle.
Okay. Now, you heard me talk earlier about the tail of spins. Do you get up in that axilla as well?
Yeah, sometimes. I'm
Okay.
not regular with it, but sometimes.
Well, I do encourage you to be regular with that because that is where a lot of, research has shown or has stated there's a lot of where your manifestation of cancer getting that group of nodes right there. That's why it's so important to get in that area as well.
Okay.
And also, check for any kind of discharge from your nipples as well. Okay. Do you get in front of the mirror and do as I had you do there?
Yes, I do that.
You did? Oh, okay. All right then. Very good. Now, if you will, let's go ahead and lean back again. I'll tell you what. Can we just there's a sheet there. I can use that. And what part we're having to simulate here is this bed does not raise up, but I would actually have this bed up at a 30 to 45 degree angle right now. And while you're in this position, Missy, I'm looking at your neck. Let's see any pulsations that you might have going on there. Okay. Well, that's very good. Okay, just breathe very lightly. I'm just listening to your heart. Let me pull this part up. Thanks for the gratitude words there. Thank you. And if you'll just leave your hand stand to sign for me, please. Thank you. I don't see one, but I'm kind of feeling for a pulsation there. Which is good that you don't have one very obviously, because that's not a very good sign, but that's good there. Weren't you off your Coreg for a while? Or off medication for a while at one time with your...
Yes.
And all I'm doing is reversing now, going and listening to the same areas around your heart with the bell for any additional heartbeats. This will wash off probably. Okay, take a deep breath. Okay, you went out. And just listening over some of your arteries for what we call breweries again. Let me know if I hurt you. You ever had a problem with your spleen or your liver ever being on? I mean, they're not now, just was curious. Okay. And tell you what, let's do the old 99 again.
99,
Okay.
99, 99, 99, 99.
Okay. Very good, thank you. I wasn't able to do this when you were sitting up as well. Okay. Got nice good pulses here. Good circulation there. Okay. I'm gonna feel, just spread your leg just a little bit here. What I'm doing is, while I've got you here, I'm just gonna go ahead and check, some of your pulses. Very good. Okay. Okay, just a minute. All right, well, I've got you here. Let's go ahead and let me see you. Let's do a little range of motion. Just relax. I want you to, all right, now what I want you to do is just take your leg and just lift up, just bring your knee up here, almost like you bring to your chest, left side first. Okay, all the way back in. All right, do it again. All right, good. All right, do the other side, bring it up to your chest. All right, very good. All right, and try it again. All right, good. Okay. All right, push with your left. All right, push with your right. Very good. Pull back on both of them. Very good. Very nice. Okay. You're gonna feel these touching the bottom of your foot. Okay, I'm just checking for Babinski's. Check. Yep, you are pretty sensitive, are you, Miss E?
Yes.
Yes, you are. Okay. Tell you what, I think we can go ahead and sit back up now. Here you go. Are you doing okay? Oh, hopefully it won't be much longer here. All right. Now, some things I want to do here is do a few of the neuro checks here again. What I want you to do is close your eyes, okay? And I want you to tell me, hold your hand out, okay? What is this I'm laying in your hand? You can grab it, you can close on it.
Pen?
All right, very good. All right. Now with your eyes still closed, tell me, and we'll turn your hands down like this, okay. Tell me which way, tell me if I'm going up or down with your finger, okay?
Down, up, up, down, up.
Okay, that's good. You can open your eyes now. All right. Again, we're just checking sensation and with your eyes closed and all. All right, now I want you to touch your nose. What we're going to do, I'm going to reach out there and I want you to touch my finger. We're going to meet right about here, okay? All right. Come to me. Back. Back. All right, very good. And put your hands on your right there. Now, I'm not very good at this either, but I want to see how your reflexes are. Just try to go back and forth as quickly as you can. Well, not just that, but try to like you're slapping yourself like this. Try to do that. Okay? How fast can you go? Okay, that's good. All right, very good. I do need to lay down one more time. I'm sorry. Okay. So what I'm wanting you to do, ma'am, is just, if you will, take your heel of your foot and put it down here on the shin and run it all the way up and all the way back down. Very good. Do the same with the other. Okay, very good. Again, that's another neural check that we do. All right, for cerebellar function, actually. All right, go ahead and let's help you back up. And let's see what else I think I might do. Okay. We're going to simulate you got no slips on you, no slippy on you, because you're barefooted, as we know. We wouldn't normally let you do that. So anyway, we'll simulate that. I'll put some on you. What I want you to do is just go ahead and come over and stand up, please. All right, put your hands down, go to your side. All right, and shut your eyes. Okay, open them again. Shut them. Okay, you can open them up again. And that's a Rosenberg test. It's just basically see if you maintain your balance when you take away the sense of vision and stuff. All right. I messed you up, didn't I? All right. What I'm going to want you to do is kind of walk. I'll bring you over there. Then I want you to walk this way on your tippy toes, and then. I'll tell you what to do next in just a minute here. Okay, come over here. Just come over here. All right, if you will, just want you to first walk on your tippy toes over there. Okay, good. Turn around and walk back this way on your heels. Okay, very good. Turn back around again, please. And just put heel to toe. Just walk heel to toe all the way up for a little bit. Okay, very good. All right. All right, turn back around again. Now, if you will, just come back this way. I'm just going to have you bend over. I want to look at your spine real good. Just go ahead and lean over. That's good there. And just kind of relax there in that position. Okay, sit up. Now, while you're there, fix this. All right, what I want you to do is turn sideways for me. That's good. And I just want you to, I'm gonna maintain this for you, but just lean back as far as you can, bending at your waist. All right, very good. Okay. All right. Bending at your waist only, twist to your left. Twist to your right. Very good. Okay. Now, I want you to do like this. You know, I'm going to maintain your hip, but I want you to just lean over straight to one side and one side of your hip again. I'm going to hold this for you. All right, go to your left. And go to your right. Any discomfort or anything with that?
Mm-mm.
Okay, very good. All right. Go ahead and sit back down. Yes, ma'am. Come back here and just relax. And I did want to see if you have any tenderness down in this area here. Just kind of checking your kidneys. Does that hurt you?
Mm-mm.
And I'm going to simulate my tuning fork. Going to do another part of our hearing test here. You know, earlier I did the little whisper test. We're going to check for basically conduction and also sensation or sensory as well through air. What I'm going to do is I'm going to get this tuning fork and I'm going to put it right up here.
Mm-hmm.
And what I need you to do is tell me, do you feel or hear the vibration in both ears?
Okay.
Okay?
Yes.
All right, very good. All right, now this is what we call a rinse test, and almost the same concept. Again, I'm going to use the tuning fork, and what I'm going to do is I'm going to do one side at a time. I'm going to place it right here.
Mm-hmm.
But what I want you to do is tell me when you first hear it and when it goes away.
Okay.
Okay, because I'm going to time this.
Okay.
All right.
Now. It's gone.
Okay, very good. Now, I'm going to do the same thing. And what I'm going to do is use the fork side now and put it up here. And I want you to tell me when you hear it and tell me when it goes away. Okay?
I hear it.
Okay.
It's gone.
Good. Now, just normal. I'm going to look for here again is just again testing your hearing. Air conduction should be a little bit longer. You should hear that tone a little longer than you would on the bottom. So here we go again. Tell me when you hear it.
Here. It's gone.
Very good.
I hear it.
Okay.
It's gone.
All right, very good. All right. Last thing we'll do, I think, is do our deep tuning reflexes. I'm going to beat on you a little bit with my rubber hammer. So again, simulation. So anyway, we're going to start with your arms first. We're going to check your brachial. And for the sake of time, we're just going to do one side. And we're okay with doing that. So again, this is the only one that I actually hit it on my thumb. But I'm going to hit right here. I'm just going to hit this tendon here, and what we should have is just a little reflex, a little flexion. Ready?
Mm-hmm.
Okay. Okay. Very good. Okay. Bend your arm. And just kind of let it hang like that. Okay. Okay. Did you feel that?
Mm-hmm.
Okay. Alright, just relax. Again, this is another reflex we have, brachial radialis, I think it is what we call. I don't want to hit you now like this, we're simulating. I would actually hit you right on this bone here though. That'd be hyperflexia actually, man. Okay, very good. Alright, again, well, we don't have to do it one side for the sake of the exam. Okay, now I'll do telereflex here. Again, I'm just going to hit you right here, and you should have a little extension here. Okay, very good. And here, which I didn't have to do. All right, and lastly, we'll do your Achilles heel. There you go. You feel that? All right. There you go. All right. Well, that's pretty much it. Oh, wait a minute. Nope. There is one last thing. I'm sorry. Last but not least, again, I want you to close your eyes and just kind of, again, we're going to do a sensation check here.
Okay.
I want you to tell me if it's dull or if it's sharp. Okay.
Sharp. Sharp. Dull. Sharp. Dull. Dull. Sharp. 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 Dull. Sharp. Dull.
Okay. Nope, nope. All right, you close your eyes. And you just tell me what side or where I'm actually touching it.
Left. Up. Bottom. Arm, left arm.
All right, that's good. That's it. All right. Do you have any questions for me? Okay. What we're going to do is take a look at some of the lab that they had drawn on you, and of course your urine and all. And I know the doctor wants to talk to you
Okay.
to probably reassess if this medicine is enough for you. I mean, you sound like you have quite a frequent history with these migraines and all. I know they can be probably a little humbling, I guess. It probably really plays into your daily activities. So, anyway, that's pretty much it. You can wait here if you want to, and I'll go get him next. Do you have anything for me?
No. Thank you very much.
Okay, well, thank you again for your time and your patience, as always. And that's all I have.
Okay, thank you.
Thank you, ma'am.